Hello, today is the study design part 2. To understand well about bias, we should know about exactly which each study is talking about. So, uh, types of the research study is sorry. Types of the research studies, observational studies versus clinical trials. Mm. The first one is a case report, case series report. Other is a cross-sectional study, is the exactly the time it's cut in the time. Case control study, cohort study. The case reports brief objective report of a clinical characteristic or outcome from a single clinical subject or event. Example, one patient with a 23 years old man with treatment with resistant tuberculosis. Or it's important to it's disease. It's not common, no common diseases. Uh, Case series report is objective report of a clinical characteristics or outcome from a group of clinical subjects. The cross-sectional study is the presence or absence of the disease, and the other variables are determined in each member of the study population or in a representative sample at a particular time. The co-occurrence of variable and the disease can be examined. It's just in the time. So the next cross-sectional study, the disease prevalence rather than incidence is recorded. The temporal sequence of a cause and effect cannot usually be determined in a cross-sectional study. Example, who in the community now has a treatment resistant tuberculosis. Now, a case control study identifies a group with the disease and compare them with a suitable comparison group without disease. Almost always a retrospective. Okay? Compare cases of treatment-resistant tuberculosis with cases of non-resistant tuberculosis. Okay? So, case control study cannot access the incidence or prevalence of the disease. Can help determine causal relationship and very useful for studying conditions with very low incidence or prevalence. An example, in a study of chemical workers, 400 workers with respiratory disease were selected for examination. The investigators obtained a history of exposure to a particular solvent in both groups of workers. Among workers with a respiratory disease, 250 gave a history of exposure to the solvent compared to 50 of the workers without respiratory disease. The study design can be best be described as case control, cohort, cross-section study, community trials, comparative clinical trials. So it's a case control, it's a retrospective study. Okay? In patients who have the disease and without the disease exposure in a risk for the disease. The last one is cohort study. It's a prospective study. So, to differentiate this, you have a cross-section at the time, the cohort in the future, and the case control is a retrospective study. So in the cohort, the population group those who have been exposed to risk factor is identified and followed over time and compared with a group not exposure to the risk factors. Outcome in the disease incidence in each group following a prison intimate population and making the development of treatment resistant tuberculosis. Also in the future. Okay.